Yeah, so we are presenting several abstracts from the ARCHES trial at ASCO. Just as a quick reminder, the ARCHES trial is a study of metastatic hormone-sensitive prostate cancer patients who were treated with androgen deprivation therapy plus enzalutamide versus androgen deprivation therapy alone. The study showed that there was an overall survival benefit and a radiographic progression-free survival benefit with the addition of enzalutamide to ADT. And it's been an important study in changing the standard of care practice for metastatic hormone-sensitive prostate cancer with the addition of enzalutamide to the treatment armamentarium for these men with metastatic hormone-sensitive disease. So in this analysis, what we did was we looked at DNA repair or DDR alterations in men with metastatic hormone-sensitive prostate cancer from the ARCHES trial, and we actually looked at germline DDR alterations in blood using a 16-gene panel. So we know that these DDR alterations are prevalent increasingly in men with metastatic castration-resistant prostate cancer, more advanced disease. That's both germline and somatic or tumor-based alterations. In this analysis, we focused only on germline alterations. And there's a couple of reasons that we did that. One is that these alterations have been associated with, in some analyses, with worse prognosis. And so we were interested in looking at whether men in general with those alterations did worse, irrespective of what treatment they received, whether it was ADT or ADT plus enzalutamide. And we also wanted to see whether there was any predictive value of these alterations to see whether men with enzalutamide did worse or not with DDR alterations. And what we found is that approximately 5% of men, 5.2% to be precise, of men had DDR alterations in this study, which was slightly lower than we expected. From previous analyses, we thought it would be between 7 to 12%, but it wasn't far off. It was 5%. What we saw was that men with these DDR alterations, really there was no particular clinicopathological characteristics that were associated with the presence of these alterations, such as disease volume or other characteristics. And because the prevalence was quite low of these alterations, we really couldn't do any particular analyses in terms of whether these were prognostic or predictive of outcome. So I think this was important to analyze because these alterations are prevalent in prostate cancer with more advanced disease, but perhaps a little bit less common with earlier, metastatic hormone-sensitive disease. Nevertheless, finding these alterations is important for those men with germline alterations. There are potential implications for their family, as these can be hereditary in some cases. So I think that it's still important to test for these alterations in this population, but perhaps there's less in terms of identifying hereditary alterations that can be passed down across generations for these men. But from a clinical point of view, perhaps there's less relevance to their particular outcomes if they have these DDR alterations detected.